Hello everyone, I am Dewan Mahmouda Zaman. First of all, I would like to thank the committee to arrange this fifth international multi-conference on artificial intelligence technology and giving me the opportunity to present here today. My paper title is Scheduling Strategies for Operating Room Surgical Scheduling Problems, and my co-author is Professor Dr. Masri Ayub. So today I will be discussing about introduction, motivation, scheduling strategies, strength of each scheduling strategies, limitation of each scheduling strategies, summary of methods, and conclusion of my paper. So surgical scheduling problem deals with the task to find an optimized surgery schedule with the aims of minimizing the end time, overtime, and optimized surgical resource utilization. It is a combinatorial optimization problem that aims to allocate the time and room to a set of surgeries to be performed over a day or a week by the available resources. Optimizing surgical scheduling problem plays a crucial role in improving hospital healthcare services. So, so for many studies tackle this problem with different perspectives, such as different solution approaches are applied, different decision levels are considered to solve, different mathematical models are designed to solve this problem, and scheduling strategies are considered to solve this problem. So here is some more detail about surgical scheduling, that a surgery needs to pass through several processes to complete the surgery flow. When the procedure starts, multiple resources are required throughout the surgical process. Here we can see in the diagram that we need material resources such as pre-operative holding unit beds, operating rooms, wards, ICU beds, and also we need human resources like surgeons, nurses, anesthetists, transporters. So clearly it is a very complex problem to solve in an optimized way. So the motivation behind this is increasing healthcare demand, which means that the operating room plays a crucial role in healthcare and the demand of quality service is increasing day by day. Secondly, about cost and revenue of hospital, which means that the operating room is the core sector of both cost and revenue in a hospital. It is reported that more than 60% of patients are admitted in the surgical operation. And lastly, different strategic plan for optimization. In more detail, that the surgical scheduling problem is a complex problem to solve because it involves many resources and stages. The target of hospital managers are to maximize the utilization of the operating room, and it leads to different strategical plan. So there are different scheduling strategies, which are block scheduling, open scheduling, and modified block scheduling. So first I will discuss about the block scheduling. So a block scheduling strategy is a strategy where each operating room is pre-allocated to a specialty with different surgery groups such as surgeons, and each operating room can be divided into different time slots for different specialty or can be allocated with a specialty for the whole day. And some human resources such as nurses and anesthesiologists are assigned to each block. Secondly, about open scheduling. This strategy is the opposite of the block scheduling strategy. There is no pre-allocated time for any operating room. Surgery can be assigned to any operating room regardless of the type. If the number of available required resources is available, and the surgery can be performed in any suitable room. Most of the time, open strategy follows first come first serve principle, where any patient can be assigned to any available operating room. Lastly, about modified block scheduling. This is the combination of block and open scheduling strategy to use the advantage of both strategies. There are two ways to modify block strategy and apply it as a modified block scheduling strategy. First way is to reserve some operating room and keep it open for others. And the second way is to release unused block for the remaining surgeries. Now, I will be discussing about advantage and disadvantage of block scheduling. So the advantages are in real life, block scheduling strategy is applied more often in many hospitals because of complexity of its strategy is lower than open scheduling strategy. Secondly, surgeons' preference is to centralize all the surgeries at a specific time of workday. So applying this strategy is suitable for surgeons because working time is flexible in this strategy. And lastly, the strategy reduces the time required for preparation, cleaning time between surgeries, which also reduces the patient's waiting time. And the disadvantage is in this strategy, the operating room is allocated for some specific surgeon. And in real life, block scheduling strategy is applied more often than many hospitals. Uh, so once a block time of an OR, which means operating room, is allocated to one surgeon, other surgeons cannot occupy the block, even if that surgeon cannot arrange any surgical case in that block time. Now, about the open scheduling. So, the advantages of open scheduling are it is more flexible strategy because there is no pre-allocated time block. And secondly, with the comparison of block scheduling strategy, the open strategy has a better utilization of operating room. But we can see that there are many disadvantages of open scheduling, which are a bad design of an open system can cause a high loss rate. Then this strategy is not popular in real life because it causes inconvenience and also surgeons cannot centralize their work. Then this strategy may have to face inconvenience when they have to deal with emergency cases because patients have priority to choose time. Lastly, this strategy may cause long waiting time because of dynamic patient arrival. Then, advantages and disadvantages of modified block scheduling. So, the advantages are this strategy is more convenient of operating room management because it can assign other operations to perform in the operating room to prevent the loss of late cancellation, and it is capable to solve the problems mentioned for open and block scheduling strategy. In the literatures, there is no disadvantage reported for modified block scheduling strategies. Now, we will be discussing about some methods considered to solve this scheduling problem, where different scheduling strategies are focused. So we are here. I randomly took different papers to find out about the most scheduling strategies are studied about. So we can see that from the year 2018 to 2020, open scheduling strategy got more interest, but block scheduling strategies didn't studied much, and also there is no work reported about modified block strategy although I took the paper randomly, so modified block scheduling strategy did not uh, studied enough for last few years. And we also can see that meta heuristics such as adaptive taboo search, hybrid gray wolf optimizer, hybrid genetic algorithm, taboo search, hybrid genetic algorithm with a variable neighborhood search, simulated annealing, genetic algorithm, and variable neighborhood distance are mostly applied, which means meta heuristics are mostly applied to solve this problem where open scheduling are considered more than block scheduling strategy. So the conclusion is of my paper is many works are done so far with different scheduling strategies, but number of studies differ from year to year. For example, until 2010, block strategy got more attention, but now most of the studies focus on open scheduling. On the other hand, there are very few studies on modified block scheduling strategy. So, in real life, block scheduling strategy is more preferable because human resources of surgery can centralize their work, but still there is some limitation in this strategy. And to overcome the problems of block strategy, modified block strategy can be applied, which is also preferable for the management. So, these are the findings of my study, and here are some references I mentioned in my study, also in my presentation. And thank you all for watching my presentation.